I'm the director of the melanoma unit in the Hospital Clinic of Barcelona, so I'm dealing with skin cancer patients in my profession since more than 20 years indeed. I'm running the unit since 2003, and this is a multidisciplinary group working and fighting against skin cancer and melanoma patients also. When you deal with skin cancer, there are no really easy cases because the patient is many times anxious with results of your consultation. But the most important or the best way you face this disease is when you have early diagnosis. So when you explain the patient that the patient is cured, and this is very good news when we are able to detect very early the cancer, and the prognosis is 100% positive for the patient. This is really very good situation, and probably this is the best scenario where we are working. And the other side of the coin is clearly it's when you have to tell the patient bad news, and this is unfortunately often seen in my center because we are dealing with difficult patients and sometimes with with situations where the cancer is not curable, unfortunately. Doctors are not very good doing prognosis. Probably it's the worst thing we are able to do. And sometimes the prognosis is clear concerning statistics, but the statistics are not always the best way to provide information to patients. So we try to get the patients in the most positive way as possible, and trying to provide the patients the feeling that we will be there close to them even in the worst situation, that is when the disease is not curable. And I can tell you that the patients feel much better when they know that you will be there even in the last moments. But bad news are something difficult to tell, and you need to have experience how to deal with different personalities, and not all the patients have the same ability to confront this news. So this is something that it's not easy. We try to teach our professionals how to deal with this very difficult situation, and this is something that it's one of the most important work we have to do as doctors. We, as doctors, not ever are able to cure the patient. So to try to deal with patients, even when you know that the disease it's not curable, but you can do the mitigation of pain or suffering the patients from some complications that in the end are really making the patient suffer or having terrible pain, psychological pain. It's something that we can do very well nowadays, and this is information that you, of course, you need to explain very well to the patient. In the society, cancer is really a strong word today. Even in advanced societies, this is something that we try to avoid all the time. This is a disease that is not acceptable for a society based in concepts like being young forever, and beauty, and pretty nice life, and money. So cancer and dying from cancer is a stigma, of course, today.